Okay, so hello friends, welcome to back my channel. Medicine 101. Today we'll talk about cardiac cycles from the physiology aspects. Okay, so what is cardiac cycles? So the cardiac cycle is the thing that we've seen in terms of what on on systole and on diastole. Okay, during the on systole and on diastole, whatever the thing we'll see in a nutshell, we can say that is the cardiac cycle over here. Okay, so let me write it over here. We'll see one systole plus on diastole. Whatever the thing we'll see, that is actually the cardiac cycles over here. Okay, so let's start by drawing a little diagram over here. So first of all, whatever the thing we'll see over here, see, so I'm just saying about the left head. Okay, so what about the left head, the same thing we'll see in terms of the right head. Okay, so I'll just continue with the left head. Okay, and whatever thing I'll see, we'll see the thing in terms of the right head as well. Okay, so let's continue. So for the first thing first, so let's assume it's the left head over here. So let's draw just like this. Now see, whenever we're reading the cardiac cycles, what we have to know the three things. Okay, we have to know in each cycles, in each phases at the three levels. What is happening in the within the atrium, what is happening within the ventricle, and what is happening within the aorta over here. Okay, so the first thing first. So just draw just like this. So in the first phase, what we will see, whenever the SN node that will fire at first, we will see what? The atrial contractions. We will see what? Atrial contractions. The first thing we will see the atrial contractions. And whenever we will see the atrial contractions, it will sequence, and whatever the blood is present within it, this blood that will come out where? Within the ventricles. Now see, whenever the atrial contract at the time, we will see 80% of the ventricular filling, 80% of the ventricular filling that will be already done. So 80% of the ventricle that will be already done. Okay, how these things is filled, I will just talk in subsequent parts. We will get it automatically. Okay, and the first thing what we will see in this valve, that will aortic valve that will get closed over here, that will be closed, and the mitral valve over here that will be opened. Okay, and whenever the atria that will contract, there will be production on top of the wave that is known as A wave over here. Okay, so whenever the atria is contracting, we'll see the production of what? A wave, just like this. Okay, now see, whenever the atria is contracting at the time, the rest 20% of the blood will come out over here, and it will fill the ventricles. Okay. Now see, whenever the atrium is contracting at the time, we'll see the pressure within the ventricle that will be around 0. Okay, and whenever the blood will just keep on coming over here, we'll see the blood. Okay, the pressures within the ventricle that will keep on rising. The pressure within the ventricle that will keep on rising over here. For the first phase, you can say in terms of what? Atrial contraction. So atrial contraction. Now we'll talk about the second part. Whatever the thing we'll see in terms of the second phase. Okay, now see it over here. Whenever the atrial contraction is done, the atria will come on relaxations, and onset of the ventricular contractions we'll see over here. So see, let me draw it once again. Just like this. Now see, whenever the blood is coming, keep on coming within the ventricle from the atrium, we'll see the pressures. I will say at first it was 0. Now pressure, for example, from 0 to 2 will keep on rising from 5 mm of Hg. Now whenever the pressure will be 5 mm of Hg at the time, the pressure within the ventricle that will be more than the pressure within the atrium. So there is a chances for the back from the ventricle to the atrium. As a result, we will see there will be closure of mitral valve. There will be closure of mitral valve. So we will see the closure of mitral valve, and this valve will be also closed because the pressure over here around 80 mm of Hg. So the pressure in this time here 80 mm of Hg. So this valve will be closed automatically. Okay. Now see, in these cases we'll see there will be some ventricular contractions. See the ventricular contractions. Okay. Now see, whenever the ventricle is contracting at the time, see there is no connection in between the atrium and the ventricle. There is no connection in between the what? Ventricle and aorta. Okay. So it is acting like a closed chamber. So you can see over here, it will work as what? Isovolumetric contractions. So we'll see the next page, isovolumetric contractions. Isovolumetric contractions over here. Now see, whenever using the term isovolumetric contraction, at the time what? The atrium, that is what? In the relaxing conditions. Now in this phase, we will see the atrium that will start keep on accumulating blood from the lungs. For example, just like this. Okay, it will keep on taking the blood or keep on accumulating the blood from the what? From the lungs by the venous. Okay, venous blood over here. Now see, in these cases we will see the ventricle that will act as a what? Isovolumetric contractions. Now whenever the blood will keep on coming over here, and ventricle will keep on what? Squeezing or contracting. As a result, we will see the pressure will keep on rising. For example, from 5 to it will go around 80 mm of Hg. Okay. In the next page we will see. In the next page, let me show over here. The 3 levels, we have to know at the 3 levels. Okay. So let's draw our atrium over here. Is the what? It will be closed just like this, and we will see what? The ventricular contractions over here, and we'll talk about these things right now. And definitely just like this one, that what? The atrium that will keep on accumulating blood from the lungs. It will keep on accumulating blood from the lungs. It will work as a tank right now. It will just work as a tank. Now see, whenever, just try to understand from here, whenever the what? Mitral valve that will close, we will see at the time we will see what? On top of the jerk. As a result, we will see production of onboard wave. Okay, that is known as the C wave. So first we got over here the A wave for the atrial contraction. Then we will get what? C wave. Then we will get C wave. Okay, so first is A wave. This second one is C wave over here. And whenever the what? Mitral valve is getting closed, as a result we will see there will be what? Production of the fast heart sound. So we'll get over here also the S1. We'll get the fast heart sound S1 over here. Okay. Okay. So it was isovolumetric contractions. And in this case, see, whenever the pressures over here from 0 to 5, it will come 80, then it will go 81. Okay. At that time, whenever the pressure will be greater than the aorta, where within the ventricle, at that time what? The ventricle that will start squeezing. And whenever we'll see the ventricle is starting squeezing or contracting more powerfully, as a result we will see the blood from here, from what? From the ventricle, it will go where? Within the aorta. From here it will go in these regions. Okay. So in the first place, as a result we will see the pressure from 81 it will go around 120 mm of Hg. So we see severe contractions over here. So in these cases the blood that will be ejected from the what? Ventricle. Okay. So in these cases, whatever the phase you can say over here, we can say a rapid ventricular ejections. Okay, so we can say rapid ventricular ejection. Ventricular ejections over here. Okay, now it will also work as a what? Tank, just like this. Now this valve that will be open, definitely it will be open. So what? Aortic valve. Now what type of the thing we will see in the next page. Let's try to understand from here. What type of the thing we will see in the next page over here. Okay. Now let's draw the same thing over here. Okay, still close this one. It is opened. Okay, now the ventricle that is keep on what? Squeezing or contracting. Now the pressure, it was what? Around 120 mm of Hg right now over here. Okay. Now the pressure we will see there will be the fall down of the pressure from here 0 to 5. Then we got what? 81. Then we got 120. from 120 mm of Ag, it will just keep on falling. Okay. Now at that time we'll see the ventricle will contract, but not severely. The contraction will be not that much hard over here. Okay. So in these cases there will be slow ejections. In these cases we will see slow ejections of the ventricle. So slow ventricular ejections we will see in these cases. And definitely the from the lungs the atrium, that will keep on accumulating blood over here. Just like this. And see, whenever the atrium is taking the blood from the lungs, we will see on top of the wave, productions of the wave, that is known as V wave. So first we got for the atrial contraction what? A wave. Then we got the C wave for what? Closure of the mitral valve. Is the A wave, is the C wave, and we will get a V wave just like this. Is for the atrial filling from the lungs. Okay. Now this phase I already said it over. Whenever the pressure that will got keep on decreasing after the severe contractions over after rapid ventricular ejections phase, you will see the ventricle will contract but not that much severe. Okay. In these cases we will see the slow ejections, slow ventricular ejections. Okay. So in these cases we can just define the term over here: slow ventricular ejection. Okay, we'll see slow ventricular ejections. Now after that we will see in the next phase that the pressure over here, the pressure within the ventricle, that will be less than the pressure over within the what? Aorta. Oh, so whenever the pressures within the ventricle will be less than the pressure within the aorta. Now see, still we will see in these cases some amount of the blood that will be left over here. As a result, we see, as we know, the atria what? The aorta, that is got elastic in nature, so it will just stretch out just like this. So the blood, amount of the blood that will be over here, it will still squeezing the blood just like this. So as a result, we can say in the next phase, the pressure within the ventricle, that will be less than the pressure within the aorta. Okay. Now whenever the pressure, see, whenever the pressure that will be less than the aortic pressure within the ventricle. Now what type of the thing we'll see over here? See. Still close this one. Now whenever the pressure over here, that means what? It will go under relaxations. In the next page you will see the ventricle that will go under relaxations, and whenever it will go under relaxation, and this time we will see the pressure within the ventricle that will be less. As a result, there will be closure of what? There will be closure of aortic valve. Along with that, we will see in these cases there you are the closure of the mitral valve. Now in the same thing, there is no connection in between the ventricle and the aorta over here, and there is no connections in between the ventricle and atrium over here. Okay. Now it is also just acting like a single chamber. So at this time, the ventricle is acting just doing the what type of thing, relaxations over here. So or diastole over here. So you can say isovolumetric relaxations. In these cases, what can you see the term over here? Isovolumetric relaxation. Isovolumetric relaxations over here. Okay. And in these cases also we'll see what? It will act as a tank or reservoir that will keep on accumulating the blood from here. Okay. Now we'll see the blood that will be here much more. And whenever the pressure, in these cases we will see the pressures will come around, the pressure over here we will see in these cases, this pressure will be less than the what? Less than the atrium. The pressure in these cases we will see in this phase, that means in the isovolumetric relaxation, in this condition we will see the pressure within the atrium that will be greater than the pressure within the ventricle. So definitely it's easy to understand what we will see in the next phase, that there will be opening of the mitral valve. Okay, in the next phase you will see opening of the mitral valve. Okay, let me show just like this. In these cases we will see the opening of the mitral valve over here. So whenever we see the opening of the mitral valve, this is closed still. Now the blood, accumulated blood within the atrium from here, the blood that will keep on coming. Before that, let me tell you something. Whenever the water, so after the slow ventricular ejections, we will see some amount of the blood that will be still left within the ventricle. This amount of the blood that will be not ejected by the ventricle. So the rest amount of the blood that will be not ejected by the ventricle, this is known as systolic volume. Okay. Now see here we got already the systolic volume. Now what? The blood was accumulated within the atrium. Now this blood will keep on coming over here. Okay, and whenever the blood will come, that is not for the atrial contraction, because the blood was keep on the blood was got accumulated over here. Now the pressure within the ventricle that fall down, and the pressure within the ventricle less than the atrium pressure. As a result, we will see for the pressure differences, the blood from the atrium, the blood will come over within the ventricles. Now in these cases, we will see what rapid passive ventricular filling, or rapid. I am saying the passive because there is no atrial contractions over here. Okay, so we will get over here rapid passive ventricular filling. Ventricular filling over here. For example, it will just push much, just like this. Now we will see in these cases there will be what? There will be removal of the VO. That means the heart, the lungs will not get the blood from. Okay, let me show the diagram. It will be better to show. Now in these cases, we will see in these phases from the lungs the blood will not come over here. Just okay. So there will be what? There will be no VO, just like this. So in these cases, whatever thing we'll see, for we got over here what the A wave for the atrial contractions, then we got the C wave for mitral valve closing, then we got the V wave just like this for the atrial filling from the lungs. In these cases, we'll see there will be what? Removal of the V wave, because in this time the lungs will be not the part of this case. After that, whatever the thing we'll see. Okay, the next page. In the next page, we will see. Okay, let me use this color for better understanding purpose. Okay, in this page, we will see. Okay, just try to understand. This valve will close because the pressure within the what? The pressure within the ventricle is less than the pressure within the atrium. Now, in this time, the accumulated blood what finish in this case. Okay, now we will get the blood from the lungs directly. Now the blood that will come from the lungs directly. We will get the blood that will come from the lungs directly within the ventricle. Within the ventricles. Okay. Now in this times the blood that will come what? The slow, not like this one rapid. Okay, so we can see in these cases what? Slow passive ventricular filling. Now in these cases it will act like a channel, okay, from the connection in between the lungs and the ventricle. Okay, now this whole thing that will act as a channel. We can see in this cases the phase. What? Slow passive ventricular filling, or slow passive ventricular filling. Now first we got over here the systolic volume, then we got what? The rapid passive. Let me swap to this much over here. Then we got the rapid passive ventricular filling. After that we got slow passive ventricular filling. Okay, now it will be around the 80%. It will be around 80%. Applies for my diagram. Okay, it will be around 80%. Now the rest 20% of the blood, we will see after that what? We will see that will come after the atrial contractions. Whenever the atrium that will go under the contractions, again the SA node that will fire, and from here the atrial contraction we will see the rest amount of the 20% blood that will come over within the ventricle. Then it will complete the total 100% of the blood in these cases. So this was all about the what? Cardiac cycle. Now if we just talk about in terms of their phases, now see, if we see the atrial contractions, let's write it over atrial contractions. Atrial contraction, normally we know if we for the normal individual, if we see the beats, it's will be 2 per minute. Now the cardiac cycle that will be around 0.8 seconds. Now if we see in terms of the what, the atrial systole over here, atrial contraction, there is for the 1 phases over here. See, there is no atrial systole, so we can consider for the 0.1 second over here. And what about the ventricular systole? The ventricular systole we can see over here, this phase, this one. So we are getting the 3 phases. Consider in terms of the 0.3 second. Okay, and if we say what about the atrial diastole? See, atrial diastole, we are getting this atrial diastole still over here. This one, we are getting this one, and this one over here. So 1, 2, 3, 4, 5, 6, around 0.6 second we will get over here. And the ventricular diastole, where we will get over here. See, we will get the ventricular diastole over here. We will get the ventricular diastole over here, and here we get around 0.3 seconds. In some book it mentions 0.2 seconds, around just like this. Okay. Now the longest phase, we will get the longest phase over here, where in the what, slow passive ventricular filling. This is the longest phase of the cardiac cycle. That's it, known as diastasis. So what is diastasis? Diastasis is the longest phase of the cardiac cycle. So when we will see from the lungs, the blood will directly come where, within the ventricles. Okay. In this cases we will see the atrium that will act as a channel. Okay. The blood will come directly within the ventricles. So that is the longest one. So let me write it over here. Is the longest phase over here. That is known as the diastasis. After that, again this node will fire again. We see the atrial contraction in these cases. Okay. In the second part of the video, I'll just show you through the graphical representations of what type of things are going. These type of things are occurring over here in the different aspects. Okay. So thanks for watching. If you think that this video is useful for you guys, then of course I can say you just, इस वीडियो आपको अगर अच्छा लगता है तो जरूर सब्सक्राइब कीजिए मेरे चैनल और शेयर कीजिए ज़्यादा से ज़्यादा ताकि बाकी लोग को इस वीडियो मिले। सब्सक्राइब।